I could not wait to share this case with you and go over step by step what I saw needed to be changed and how we got to it. So let's look. What's going on? Clearly we see a lot of broken teeth. We see little teeth and we see dark teeth. For this really slender, nice jawline, I mean, she deserves a gorgeous smile for this face. So what do I see is going on? We have chipping and really acidic erosion all the way, about 50% of this tooth. We have peg laterals here, and really we have decay in a lot of these areas. But the smile was set up by an orthodontist originally to have the teeth in the right position. Now we have to do beauty and health. So what do we see on this side? Obviously this smile doesn't follow the shape of the lower lip. There's gaps in between the laterals, and there's a lot of decay here. And essentially the same exact thing going on this side, peg laterals and decay going on in all of these teeth. So in order to accomplish the best result, we had to do the full upper and full lower smile so that we got them healthy and looking beautiful. So here's a few things that are going on. You can see when you raise the lips, there's a few other things going on. It's like removing the curtain. So you see a lot of this decay and recession in areas where we will now fill that in with porcelain and provide a patient with a night guard after the treatment to make sure that there's no forces being put on the teeth that can't be handled, and also going through a really amazing oral hygiene routine, seeing my hygienist regularly. These are very important things that must be addressed before starting treatment, or else you're gonna see the patient in 5 years and you're gonna wonder why these things happened. You have to foreshadow, be able to explain to the patient, in order to start a case like this, there are a few rules that must take place. So now that I explain what's going on and these teeth are all worn, let's look at the final result of how we got from here to here. This is now the gorgeous, natural, healthy smile that she has always dreamt of. Proportions are correct. The preparations are minimal in areas that can be. In places that needed decay, we had to remove the decay. And the beautiful thing is when doing a porcelain veneer, you can wrap around the tooth and actually incorporate the decayed area in with the veneer, and we call it a veneer inlay. So a lot of these back teeth are veneer inlays, and these front ones are just purely porcelain veneers that wrap around and act as a thin shell of porcelain. So we look at the right side. Now we see how it beautifully mimics the shape of the lower tooth, and the same thing with the left side. And now you can see how we have an amazing interaction between the upper and the lower teeth. It just seems like she was always born with a smile. Let's go back and review what we started with, where we are, and it's really important to zoom in and see how you have to be very meticulous with the preparations so that there's a beautiful flow between the pink of her gums and the white of the porcelain. Not only on the top, but on the bottom as well. In areas that she has recession, we're actually going to monitor this, and things get worse, we're going to have to do connective tissue grafts. But that's why you don't fill this area with porcelain completely, because otherwise you won't be able to use a connective tissue graft to fill that area and make sure that tooth stays healthy for a long time. This middle photo is where we started on a close-up, and these top and bottoms are where we ended for an amazing human being with an amazing smile.